Dear colleagues, it's a pleasure for me to participate this year also by video, maybe next year, which will be in presential, with this conference focusing on inflammatory skin diseases and the correlation between clinical features and microbiome changes. So I'm a dermatologist at the University Hospital Saint Louis from Paris. I'm working in the inflammatory diseases pole. These are my disclosures. Part of the data presented here are under print, under publication with a team from Galatz in MDPI Life Dermatology, but there are also other publications. So we will focus on acne microbiota and metagenomic analysis of skin microbiota in acne, and then on atopic dermatitis microbiota and metagenomic analysis of skin microbiota in atopic dermatitis. We know that we are more bacteria than human in terms of numbers of bacteria compared to numbers of cells. And when we speak about microbiota, we speak about interactomes. And these interactomes can be between pathogen and pathogen, pathogen, commensal, pathogen, host, and commensal and host. We know that the microbiota can trigger or aggravate skin diseases, and you can have here some examples of how the inflammation is induced and activating toll-like receptor ligands and toll-like receptors and antimicrobial peptides, which are playing a role. I will come back on this. In acne, mechanisms are very well known, hyperseborrhea and hyperkeratinization, but also is known innate immunity participation with toll-like receptors and antimicrobial peptides, and microbiome changes, more and more focus on this, where C. acnes, RT4, and RT5 ribotypes have more biofilms or more resistance and adhesion than the others. This was an article that was published some 11 years ago by an American team of Fitzgibbon in Journal of Investigative Dermatology, and you can see to the right part of the screen the composition of the 10 ribotypes of C. acnes. To the left part is in acne patients. So the right part is non-acne patients, to the left part in acne patients. And you can see here that the ribotypes more red and violet are ribotypes 4 and 5. So this C. acnes ribotype 4 and 5 are more adherent and they are more virulent than other C. acnes ribotypes, like, for example, ribotype 6, which is non-acne C. acnes. What is happening with this biofilm? So this biofilm is providing to the bacteria more resistance to antibiotics, production of enzymes, finally more survival of this bacteria, and the biofilm is a form of bacterial virulence. You can see to the right part of the screen that in this anaerobic environment, the ribotypes RT4 and RT5s are living better than at the skin surface or in the infundibulum area. It's known already that Staphylococcus epidermidis can inhibit C. acnes proliferations. These are some examples of ongoing studies or already published studies, but they are even more recent than the one that I quote here, with microbiome therapeutics which are under development for acne vulgaris, and Staphylococcus epidermidis is one of the tools in topical application on acne patients. I'm putting here Brigitte Dereno, which is underlining the fact that the new targets in acne management in 2023-2024, it was beside the classical, topical, and oral treatments that you know, the microbiome-oriented therapies, innate immunity-oriented therapies, and C. acnes targeting therapies. We published some 12 years ago how a patented vegetal extract is stimulating in skin in contact with C. acnes ligands, is increasing the human beta defensin HBD2 compared to the skin the same way in the contact with C. acnes ligands, which is producing less antimicrobial peptides than the patent that we published in this publication in the European Journal of Acne. Another patent is showing that it's dose-dependent, inhibiting the biofilm of C. acnes in this in vitro model on transparent plaques, where the biofilm is here in immunofluorescence in red. And you can see more concentrated is this patent. Less important is the biofilm of C. acnes. And here we work only with ribotypes 4 and 5. What about the metagenomic analysis of skin microbiota in acne? We started in a classical clinical trial with an emulsion based on these two patents in a series of adult acne patients. And we wanted to assess in the same series of patients the microbiome at the beginning and the end of the study. And I underline that these data are under print, and it will be very soon in open access in the publication Life Dermatology issue, probably in the month of May, beginning of June, with a team from Galatz. I underline this was also. So we included adult men and women with acne-prone skin and acne severity with a scale more than 1 and less than 3, because we use only this cosmeceutical based on these two patents, no other treatment. Emulsion was applied twice per day, and the visits were made at baseline at 1 month and 2 months. Skin swabs for microbiome analysis were made in the same patients at the beginning and at the end of the clinical trial. We included adult patients with acne, where the gravity score of acne decreased, the GA score, and you can see here the significant decrease of the total number of lesions outcome, and by type of lesion, all of them were significantly decreased. This is, you have just one case. We have many photos from this clinical trial with the decrease at 2 months only of a daily application, twice per day application of this emulsion. And as I already underlined, we made a metagenomic long read full length of sequences of the ribosomal DNA 16S in the same series of patients. And we took skin swabs at day 0 and at month 2, and from non-lesional skin and from acne skin. And it's a rather complicated sequence of sequences, seeing the ribosomal DNA of C. acnes, and beside the qPCR for the density of this bacteria, we went up to the ribotypes, so the full length analysis of the sequence. And we obtained, of course, this let's say more classical composition with every color representing a phylum. And this is, in fact, a very complex composition of the skin microbiome in this series of patients. But if we focus only on Cutibacterium acnes and Staphylococcus, we made only on this, we made the full length analysis, metagenomic taxonomic analysis up to the ribotypes. You can see here how many families of C. acnes, so all the ribotypes, 10 ribotypes were identified here, but also 36 ribotypes of Staphylococcus epidermidis. And you can see here in orange, the C. acnes, the good ribotype, non-acne strain, it was not very well represented on a non-lesional skin, and it was significantly increased in non-lesional skin. Vice versa, the more aggressive C. acnes serotypes, among them 4 and 5, were more numerous even in non-lesional skin than in lesional skin. And these results were even easier to see the significance in the sense of increase of ribotypes 6, which are non-acne strain, saprophyte, and of the decrease at the end of the study, the ribotypes pro-acne, more inflammatory. So we saw that in this clinical study, combined with a metagenomic long-read taxonomic analysis, the microbiome changes at 2 months were correlated with the significant improvement of acne lesions. You have available also the poster that I presented this year in the month of March at the American Academy of Dermatology annual meeting in San Diego. And you can download this poster if you are a member of the American Academy of Dermatology. What about atopic dermatitis and microbiota? So we know that we have this triangle, which is still available and presented in different congresses. You have the physical barrier rupture. This is not new, with less filaggrin, less loricrin, and less tight junction, functional tight junction. An immune barrier changes in terms of less antimicrobial peptides and in microbiome changes in the decrease mainly of the diversity. And we know that in atopic dermatitis, the antimicrobial peptides are decreased. Staphylococcus aureus, it has a more important adhesion, and this skin barrier combined with the changes of microbiome and changes, of course, of the Th2 profile to the switch to Th2 and even Th22 are playing an important role in the inflammation and in changes in this chronic inflammatory disease, which is atopic eczema. This is an article that was published by an American team in 2012. And you can see to the left part of the slide, each color representing a phylum. You can see that there is a very important diversity of the skin microbiome in normal individuals, non-atopic dermatitis individuals. In atopic dermatitis individual, outside flares, you can see that the microbiome is diversified. Here, during the flare, the diversity decrease. You treat this patient, the diversity will increase. This was the principle of our approach in the study that I will present you immediately. So the antimicrobial peptides are decreasing atopic dermatitis, and this has an important impact on the microbiome. We also use a patent which in contact with the skin, in contact with Staphylococcus aureus ligands, this patent allowed the increase of the human beta defensin 2 in the skin in contact with ligands from Staphylococcus aureus. The clinical trial and also combined microbiome taxonomy analysis was made also. We wanted to assess an emulsion, oil and water, based on patent that I showed you. And we wanted to see in this formulation of a cosmeceutical formulation, we wanted to see what is happening from the point of view of microbiota before and after the use of 1 month of this emulsion. These are the results in terms of SCORAD outcome, which would significantly decrease after 30 days of daily applications, twice daily application of this emulsion. And here you can see some clinical results in terms of improvement of erythema, but also other signs were also improved. The quality of life also in adults, dermatology life quality index, and in the children participating to the study, the infant quality of life also was improved. And we made also a metagenomic analysis of skin microbiota in this series of atopic dermatitis. This was made in a university of Toulouse, University Paul Sabatier, in a research unit specialized on microbiota under the coordination of Professor Vincent Blasco-Bach. So we wanted to see the influence on the skin microbiome in patients with atopic dermatitis, and we wanted to see also the microbiome diversity before and after 1 month of use. So it was a similar study that the one presented on acne. This one lasted 1 month and was made on atopic dermatitis patients. The emulsion was applied mornings and evenings, and the metagenomic taxonomy analysis was made at the beginning and at the end of the study, analyzing, targeting the ribosomal DNA 16S, and we made here the sequencing of the V1, V3 hypervariable regions of this ribosomal RNA of the skin microbes on the skin of these patients. On the upper part of the slide, you can see at baseline, each color representing, of course, a phylum. You can see a rather poor diversity, not very poor, because the patients were not really during the flares of eczema. They were moderate forms of atopic dermatitis. And here you can see much more colors. That means that the diversity increased at the end of the study after 2 times per day applications. And here, even in terms of total flora, was an increase 3 times due to the diversity increase in terms of bacteria per milliliter and per square centimeter of skin. So you can see here, we don't have the time, but we made from phylum to class, to order, to family, and to genus, and we saw the increase of the saprophytes, firmicutes, and bacilli, and the disappearance of bacteroidea, which are pathogenic, and the decrease of conditioned pathogenic actinomycetia. You can see all of these details, and they are available in a poster that I presented also to the American Academy, even in an oral presentation. So the conclusions are that in this study, the clinical score, SCORAD, improved, the quality of life improved, and the bacterial diversity increased. So there was a correlation between clinical and microbiome improvement. This is the poster that you can download, and if not, Professor Aline Tato will send you both posters that he has available, and he can share them with you. Don't forget that you have a free big atlas of dermatology. Is free for all the medicine doctors in the world. You have over 13,000 of photos to be downloaded if you need for your educational purposes. You have a huge collection of dermopediatrics photos, of nail pathology, of infectious diseases, and I make once per year, twice per year, what's new at the American Academy of Dermatology, at EADV, some quiz, and you can participate to the best clinical photography contest. You can go to this website, you sign with 1 key, is an automatic access if you give just your name, the university, and the year of the obtainance of the diploma, of the graduation, and you will have forever free access to this website. And you can participate once again to the contest Best Clinical Photo 2025, and you can have the registration. You can won the registration and housing at EADV 2025 in Paris. This is the jury with professors from all the world, and the submission will open December 4, 2024, and will close April 15, 2025, and you can be one of the winners of these prizes. This is my hospital in 1607, so over 400 years ago. It's still standing, it's still nice, but we have also a modern hospital. I work here, and here I put some names of the diseases that you know very well, but who were the names, in fact, of dermatologists from St. Louis Hospital in the last centuries. Don't forget, there is a huge international congress in Rome next year, 18 to 25 of June, 2025. And it will be a very interesting congress in Rome. And don't forget also in 2027, the World Congress of Dermatology will take place in Guadalajara in Mexico from 21 to 26 of June 2027. But we will have the time to discuss about this. I am one of the ambassadors for France for this Congress, so I will come back with some more interesting information about this big World Congress in 2027 in Guadalajara. Mulțumesc foarte mult. Bye-bye.